Today's lifestyle with more of stress, lack of physical activity, improper diet is also one of the causes of polycystic ovarian syndrome. Now, because there is an hormonal imbalance. Hello friends, I am Dr. Rahul WANI, President Navi Mumbai Obstetric Gynec Society, practicing obstetrician and gynecologist since last 20 years. I will be talking to you about polycystic ovarian syndrome. Now, polycystic ovarian syndrome is basically an hormonal imbalance. It's a very common disorder seen in the reproductive age group. Around 3 to 5% of the women suffer from this disorder. The exact cause of polycystic ovarian syndrome is not known. Sometimes it could be genetic. That means if your mother or sister is suffering from irregular periods, you could also be having such a problem. It is said that such patients have insulin resistance. That means the body is unable to utilize the insulin secreted in the body in a proper normal fashion. Now, this is also a lifestyle disorder. Today's lifestyle with more of stress, lack of physical activity, improper diet is also one of the causes of polycystic ovarian syndrome. Now, because there is an hormonal imbalance in the body, the LH levels in the body are more and FSH levels are less comparatively, the ratio is altered, and there is excess of estrogens which is produced and androgens which is produced. Now, if you are obese, then the peripheral fat also causes production of estrogen, which also adds on to the problem. Now, most of the times the patients with this suffer from irregular periods. They might have prolonged periods. They might have heavy periods when they get periods after a long period of time. They could have excess hair growth on the body, which is a mark of excess androgen, which we call as hirsutism. There could be dark pigmented spots on the body, which is called as acanthosis nigrans. And to diagnose polycystic ovarian syndrome, we require a combination of 2 or 3 factors. Just a sonography picture showing polycystic ovaries is not enough. There has to be a combination of symptoms like, say, irregular periods and the blood test showing a disordered FSH-LH ratio, or hirsutism and USG showing polycystic ovaries. So there has to be a combination of features to call it as a polycystic ovarian syndrome. Now, what is important to note is that if polycystic ovarian syndrome or polycystic ovarian syndrome goes untreated for a long period of time, it can cause complications in the patient. Like there could be the patient would face inability to conceive, or she is more prone to diabetes in her lifetime, more prone to hypertension. So then it can lead to endometrial hyperplasia, causing abnormal uterine bleeding or uterine cancers. So if the patient is suffering from irregular periods very often and gets fewer than 9 cycles during a year's time, or her periods are getting prolonged more than 40-45 days, she should seek doctor's advice and take treatment. So the basic treatment here is there is no permanent cure to polycystic ovarian syndrome as such. What we can do is we can reduce the hormonal imbalance by giving hormonal pills, and so that we see that the periods come on time. And the mainstay of this treatment is basically weight loss, diet, exercise, weight loss, and physical activity. So that your BMI stays within the range of 18 to 23. If you can control your weight, the symptoms of polycystic ovarian syndrome can be minimized as low as possible. Thank you.